Today I'll be presenting Mr. James Rowan. He's a 72-year-old male with a history of coronary artery disease, hypertension, type 2 diabetes, and hyperlipidemia. He's a known patient followed in clinics for his chronic condition, and he presents today for an unscheduled visit due to worsening shortness of breath over the last 2 weeks. Mr. Rowan reports about 2 weeks ago he began noticing increasing shortness of breath when walking short distances, such as to his mailbox. Since then, his worsened. He is now out of breath after walking about 100 meters. Previously, he was able to mow his lawn without difficulty. His breathing improves with rest and when he's sitting upright. He does describe the dyspnea as exertional. There's no associated chest pain, wheezing, or pleuritic discomfort that he describes. It's worse when he's walking or climbing stairs, and he needs 2 pillows at night to sleep comfortably. He does report that his shortness of breath now limits his ability to do yard work or household chores. Associated symptoms include orthopnea, some mild ankle swelling, and occasional palpitations at night. He does deny any paroxysmal nocturnal dyspnea, dizziness, syncope, cough, fever, or hemoptysis. He hasn't had any recent medication changes and does report good adherence with his antihypertensives and diabetic regimen. There have been no recent illnesses or sick contacts. He does deny any prior episodes of similar severity. In terms of his background, his hypertension and diabetes have been long-standing, but as stated, he is well managed on his oral therapy. His last follow-up was about 3 months ago for a medication review in the clinic. His current medications include metoprolol, lisinopril, atorvastatin, ASA, and metformin. He has no known allergies. For family history, he had a father who passed away of a myocardial infarction at 68. His mother had congestive heart failure. Socially, he is a retired accountant living with his spouse. He is a former smoker, about 20 packs per year, and did quit about 10 years ago. Does drink about 1 to 2 drinks per month, and is fairly sedentary in his lifestyle right now. His diet does consist of some highly processed foods and with a very varying sodium intake. On a review of his systems, he endorses dyspnea on exertion, some orthopnea, ankle edema, and palpitations. He does deny cough, sputum production, chest pain, dizziness, and weight changes that he can account for. On physical exam, Mr. Rowan does appear to be an male sitting upright on the exam table. He does appear mildly dyspneic with our conversation. He's able to speak in short sentences. His skin is warm, and I don't note any cyanosis or pallor. Vital signs do show blood pressure of 148/82. His heart rate is 48 and irregularly irregular. Respiration rate of 20. His temperature is sitting at 36/8 afebrile. Oxygen saturations are 94% on room air. His cardiovascular exam does reveal an irregular rhythm, consistent with potentially atrial fibrillation, and his bradycardic at a rate of 48. The apical impulse is palpated laterally at the midclavicular line. S1 and S2 are present and normal. There are no murmurs, no rubs, no gallops. JVP is elevated at about 5 centimeters above the sternal angle. Peripheral pulses are 2+ and symmetric, and the capillary refill bilaterally is under 2 seconds. Respiratory exam shows mild increased work of breathing with fine bibasilar crackles on auscultation. There are no wheezes or rhonchis that I can account for, and he does have symmetrical chest expansion. Percussion is resonant bilaterally. The abdomen is soft, non-tender, there's no distension, normal active bowel sounds, no hepatosplenomegaly or ascites that can be found on exam. Extremities, he is warm. There is a +1 pitting to both ankles, extending just below the shin, but no erythema. He's got no tenderness, no cyanosis to the limbs that I can see. Neurologically, he does appear alert and oriented. Speech is clear. His gait is slow but steady. So in summary, I do find Mr. James is a 72-year-old male with a history of CAD, hypertension, diabetes, and hyperlipidemia, who's been presenting with this progressive shortness of breath for the last 2 weeks, associated with dyspnea, orthopnea, ankle swelling, and palpitations. With his exam noting some elevated JVP, by basilar crackles and a laterally displaced PMI, some pitting edema, and an irregularly irregular bradycardic rate. With this, I'd be working up my differential diagnoses and going from there. And that is my presentation on Mr. James.